is Dr. Leonard with Central Ohio Spine and Joint. And last week we talked about directional preference as it pertains to the spine itself. We talked about flexion positions and extension positions. This week what I wanted to do is just kind of break down one of those positions and talk a little bit more in detail about what specifically the diagnosis that we see associated with that position. So today what we're going to talk about is when patients actually prefer flexion movements. Those are positions like sitting, bending over, being in kind of a hunched position like this. And the diagnosis that we typically see with those patients is what we would call stenosis. Stenosis is kind of a generalized term. You can see stenosis pretty much anywhere throughout the body. And it's a term used for anytime you take a canal and you make it smaller. So you can see things like arterial stenosis when the arteries get a little bit smaller. Today what we're going to talk about is stenosis of the spine itself. So again, when we talk about stenosis, it is nothing more than taking a canal and shrinking it. And there's a number of different places that this can occur within the spine. So I'm going to zoom in here a little bit. As you can see where these nerves exit, there's a little canal where the nerve exit from, as well as if we look at it from the top, where the spinal cord is, there's what's called a central canal. So what occurs in stenosis is either with conditions like arthritis, disc herniations, disc bulges. There's a number of different things that can create shrinking of that canal. Essentially the canal just gets a little bit too small, gets a little bit crowded, and sometimes can even irritate this nerve. Last week we talked about the directional preference in which flexion actually opens that canal up, as you can see with the model here. So for patients that are dealing with stenosis type pain, like we mentioned, those positions of flexion, sitting, bending forward, seem to feel better. The reason is they open up that canal and allow for a little bit more room. In the opposite direction, when we go into extension like standing, walking, or even laying down sometimes, if you can see here, going into extension actually closes that canal down a little bit more. So it's extremely classic with patients with stenosis that we see. They talk about, they're only able to walk for about 10 or 20 minutes before they have pretty severe back pain or even back pain and leg pain radiating all the way down into the foot. So when those patients come to the office, like we talked about last week, the number one goal is to try to create that directional preference. So if they prefer flexion-based movements, that becomes the basis of our treatment. We typically use a combination of treatments here in the office. We do things like manipulation, mobilization, dry needling. We do a lot of exercise and rehab. And again, with that directional preference created, like flexion, we integrate that into pretty much everything we do. So if we're doing some manipulation, we're doing a lot of flexion-based manipulation. We're doing a lot of flexion-based exercises. So if you have any questions specific to stenosis, or if you've been diagnosed with stenosis before, make sure to comment on this video. You can send us a message. We'd love to help you out, answer any questions we can. Make sure to like and share this video as well, and we'll see you guys next time. Thank you.